Welcome, everybody. Still have a couple of people joining. It's only 2:02. We'll give them a minute. So are we recording, Anna?
We are recording.
All right. Okay. My name is Ninette Warner, for those of you who don't know me. I am the Healthy Communities Senior Resource Educator here at Cornell Cooperative Extension, Ulster County. And I am the new coordinator for this Healthy Ulster Council. As many of you know, Melinda Herzog has retired. We miss her dearly, but we are also very excited for her and her new adventures. I will let our other meeting hosts introduce themselves. If Stacy, you want to give a quick introduction?
Hello, welcome. Stacy Kraft, Public Health Education Coordinator here at Ulster County Department of Health.
Thank you. And Anna, if you would like to give a quick little introduction.
I'm Anna Herod-McGrew. I'm a natural resources educator at Cornell Cooperative Extension, Ulster County, working with Ninette.
Thank you so much. So a little bit of housekeeping. Please say hello to everybody by typing your name and organization into the chat box. This not only is a great way to say hello and welcome, but also it helps us keep track of attendance and who's here at these meetings. So that would be really helpful. Give a quick hello in the chat. Please stay muted throughout both of our presentations today so that everybody can focus on what's being said by the presenters. However, we encourage you to ask any questions or make any comments in the chat box, and they'll be read aloud and answered after the presentations. Just a brief agenda for today. We'll be going through our introductions, which will be done in the chat. Our first presentation, we will hear from Tracy Snyder and Carrie Wolfiel from Family of Woodstock on the child care crisis here in Ulster County. I'm very excited for that presentation. It is a very pertinent topic. After that, we will be hearing from Mackenzie Shorter from American Heart Association on the Check It Challenge and how you can become a champion at your own organization to help implement this great program. We'll be doing a very short stretch brain break, as I will call it, and then we will be led into our facilitated networking session, where you can briefly share your organization's upcoming program or event, and then we'll be closing out. So thank you again for joining us. We're super excited. So we will start with our first presentation on the child care crisis. I will stop sharing my screen so that I can let the folks over at Family of Woodstock share.
I will give it a shot here.
If not, I can pull up your presentation.
Okay. Do you see it?
Yes, we see it.
Okay, good. Because again, I'm on two different screens, so I don't know what I'm looking at.
Okay, yeah, just perfectly. Thank you.
That's good. Okay. All right, so I'm Carrie Wolfile. I'm the team leader of child care services here at Family of Woodstock. We're one of probably 24 or so programs. We serve in Ulster County. Child care actually serves in Ulster, Columbia, and Greene counties. We are the Child Care Resource Center for Ulster, Columbia, and Greene. We provide families with referrals to legal child care programs, as well as information on financial support. We recruit and regulate legal child care programs to ensure the health and safety and quality of care for children. And we also sponsor the child care programs participating in the Child and Adult Care Food Program, which is a reimbursement program for serving healthy foods to children. We educate and advocate for child care professionals, for families, and the community on the importance of early childhood development and education. And we're just going to touch on just one of the few things that we do at Child Care Connections, just regarding the child care crisis that's going on right now. So on this slide, it just shows an overview of the last 10 years, how we've decreased
I'm so sorry to interrupt, but we can see your notes page. Not that, I mean, you're doing a fabulous job. You
so
have
tell
no
me how to
notes,
change
but
that.
yeah, if you can.
Yeah.
Oh, maybe if you put it on your other screen. If not, it's no problem.
No, that's
It's
fine.
just a little bit small for us to see.
Okay.
Thank you.
Maybe display settings. I'm not going to touch that. Hold on here. Sorry.
It's
See,
all
technology is not it for me.
That's okay. I had my own technological challenges right before this meeting, so it happens, no big deal.
Okay, I'm gonna
So I think
go. Do you see it now? It's still the notes page.
it's still the notes page, but that's
Yeah.
okay. I think, you know, we
It's
can
really
still
not
see your
notes, but
slide.
it's just small. I don't know how to change it. I'm sorry.
Carrie, what
Right.
Yeah.
about, see, there's a little like the little magnifying glass thing there. Would that enlarge it?
No.
No?
I
Okay.
think it is the display settings, and then swap screen or,
Yeah,
How's that?
perfect.
Yeah.
That's it.
Okay, thank you.
Very good.
I'm always afraid to click something. All
Teamwork.
right, we'll go to the next one. Okay, is that better? You can see it?
yes.
Okay. So we've had drastic decrease in childcare programs of pretty much all modalities in all three counties, but specifically with Ulster County. Since 2015, we've lost 43% of our programs. Some of the reasons that we lost programs prior to 2015 was because of some of the background checks that came into effect. A lot of people didn't want to go through fingerprinting, so we lost a few there, which is fine. But then COVID hit, we lost a few more. We're starting to build it back up, but it's really difficult. It's not it's a fabulous job. We love it or we wouldn't be here. But it's a hard job to do, and it's extremely underpaid. A lot of people don't want to go into this profession. And honestly, right now, the way the economy is, a lot of people can't, they don't own their own homes. So it's very difficult to provide family childcare in a rental, even if they have the space. So we're working hard in all different avenues to try to build childcare back up, because as we have parents calling us every day looking for care, we have nowhere to send them. So we're trying to talk to them about having family or friends help with childcare, which they could get paid for if they're eligible for childcare assistance. So we try to work with the families to come up with different ideas to create childcare for their families so they can go back to work. So it's just those staggering numbers always makes people think. Again, this is just a little snapshot of what we've done for the childcare search over last year. So we gave 424 referrals of programs to families, or 424 families got referrals for our programs. And that was for 575 children throughout Ulster County. Most of the families needing care was for the 0 to 2 years, and there is literally no openings around Ulster County. We talk to programs every day and we try to get updates, but that's the most sought after age slot for care. Most families honestly do request family daycare so that they can't be home with their own children. They'd like their children generally in a home like their own. So that's why they do like the family daycare model. And the top seeking reasons are employment, seeking employment, or expecting a child. We have some parents that will call us even before they're pregnant and wanting to, get a slot. So that's what we did in 24. I'm actually going to turn this slide over to Tracy.
Sure. Okay, so as it says on this slide, one of the reasons that people are having so much trouble getting childcare, the wait lists are a mile long. I was at a daycare before getting this position, and we had people 3 years waiting and, still didn't get them in. And I know a lot of daycares are, their wait lists are, it's just crazy. Location of care, that's another biggie. If you're not, accessible to people, or, it's not on the way to work, they have to drive 45 minutes out of their way to bring their kid to daycare. That's an issue. Again, no vacancies. Everybody's full. I'm even getting a lot of times people looking for daycare for a certain age group, and I'll contact daycares that I work with, and no one has any vacancies. Everyone's full and everyone has a waiting list. And, as a result, a lot of parents have no choice but to stay home, or they might just decide it's cheaper to stay home than to pay for the daycare. I've been in that position myself. So, what is happening in programs? This is a real biggie, especially in a few of the programs I just recently started working with. They have open classrooms that are just closed because they don't have enough staff. And so, there are children that can't be served because they can't get enough staff. And a lot of that comes down to the livable wage. Daycare providers, whether they be at a daycare center or a provider doing it from home, they're not making enough. And the hours are just endless. Sometimes they're starting at 6 a.m. and they're working till 5 or 6 o'clock at night. And if you're a family daycare provider, you're not getting a lunch break. You can't leave for an hour. You're lucky, if you can get all the kids to nap at the same time, and not even all of them nap, to, scarf down a sandwich or something, but you don't get a break. And forget about taking, time off for a doctor's appointment or anything like that. It's a hard job to be in, and you truly have to do it because you love it. Unfortunately, some people really love it, but they also need to support their family. So it's just kind of a rough situation. It is undervalued. There is definitely a lack of respect. I was actually just telling someone a story where I was a home daycare provider for 6 years, and my father had passed away. And so my husband let the moms know coming in to pick up their kids. And the one mom just said, "What, so no daycare tomorrow?" And like, that's what you're dealing with as a daycare provider. Just that, they don't care if you have pneumonia and you're dragging yourself around, by one arm. They don't care. They just want the daycare. Um, there it is, changing constantly, a lot of very complicated regulations. I mean, it's changed even in the last few years since I've been here. And, and I get it, there should be a lot of regulations, but it's hard when you're the one, doing it and having to meet those regulations. And the children having challenging behavior, that's a real biggie. Um, and it's, especially if you don't have the support. If you're a family daycare provider and you've got 5 children who, are needing you, and then you have that one maybe special needs kid who's really having a problem, and you really can't meet everyone's needs all the time. And when you're doing it day after day and, year after year, and it's tiring. It's really trying. So a lot of people are just leaving the profession. And it's a shame because they're losing some really good daycare providers. So I'll hand it back over to Carrie.
Oh, okay. So what can we do to, be a solution? We can encourage people to open childcare programs in their home. We're working on how to spin it so it's, it's appealing. Advocating for policy changes. So one of the big advocacy asks right now with the Empire State Child Care campaign is for more of a livable wage. So we do every year, we work on this, and we meet with legislators and we go to the Capitol building. So we do try to work on those things, and it's getting better. What any of you that are in businesses, tell your employer about our services. We can come out to any business and help families learn about the Child Care Assistance Program, offer possible referrals, talk to them about different solutions, how we can kind of almost patchwork childcare together, but a way that would be comfortable for the families. and refer families to us. So if you know anybody that's in need, and we do other things, you know, we do have a very small supply, but we do have a small supply of diapers, and we have resources to help families get that. We, you know, we have an infant toddler specialist that can actually work with families as well as daycare programs. So we do have a lot of other resources. And the other piece on here is that income guideline graphic. So if you're a family of 4, if the family makes less than $108,000, they are eligible for child care assistance. If they're a little bit above that, I'm not sure, I can't remember offhand what the cutoff is. There is another program through Workforce Development. It's the WDI, and I could send that information to Ninette to send out if people are interested in that. So sometimes people are like $200 over the limit and they don't have services, but we can help them out with that. So those are some solutions. And here's just a couple exciting things we're doing. Right now, Golden Hill Project is underway. They're building, I can't remember how many housing units, I think 80 plus units will be there. And we're opening a daycare center. So that's where it is right now in the building process. And we'll be offering 2 shifts of care, which will help out some working families. There's also a business navigator business navigator program that just opened up this past month, and we have information on that we can send out to businesses. It gives different ideas how to help employees look for childcare, and for businesses to give incentives to employees to stay at the job. We work with the Novo Foundation. They're in the process of opening a group family child care in Midtown Kingston. We're going to be partnering with them. We also partner with Day One training program, and that's with Day One in the YMCA. And they just had their first graduating class, I think last month. I think they had 5 young women that graduated the class and will be able to work in daycare centers. And we offer a family child care training program in partnership with SUNY Ulster and OET. And that is a program that will give all the training necessary for someone to either open their own in-home child care program or work in a daycare center. And we also partner with child care assistance program. So those are all the things that we do, partnerships. And that's pretty much it. That's the, you know, the depressing state of childcare right now. So if anybody had any questions.
You can feel free to, oh, I see Vin has raised his hand. Yes,
Sure,
Vin.
go ahead.
Hi, Carrie. I'm just wondering, are there any tax credit or incentive programs for businesses to start to establish in-house daycare for their
Yes,
staff?
absolutely. That's part of the Business Navigator program. I can certainly send you the information. We just came back from the event in Orange County, launching it. We definitely have information for that. There's quite a few different tax credits
Do you
and
work with
substantial.
the Ulster County Economic Development Department, Kevin and those folks to get that?
I don't work with them, but we have met before, working with Pattern for Progress on the child care issue.
Maybe
But
even
I can,
a Chamber of Commerce presentation would be
yeah, absolutely. Thank you.
Mhm.
Hi, I'm Kristen with Ulster County Planning Office. I was just wondering, do you also have some sort of I know this is not a day childcare question, but a babysitter's training program and
Not right now,
or
we don't. That usually went through the American Red Cross. Our
okay.
trainer isn't doing it anymore, that used to. We just had a few people trained with CPR and first aid, and I believe that can be a piece of it. So when we do that, we can certainly let you know, but right now I don't know who's offering that.
Okay, and in the past when it was offered, what age was usually the of people who would start that?
I'm not sure. Marge that's on the call may know because Linda Showers used to be the one that did the course. I'm not sure of what the age group is. Sorry.
Thanks. I I don't know how to raise my hand. Sorry. Can people hear me?
Yep.
Okay. So that is an important piece. I can give Linda a call and get a note back to you folks because that is an important piece. But I also wanted to mention another barrier that I'm encountering lately. And that is in order to be a staff person in a daycare, it's my understanding that you also need a background check and a certificate from the state saying that you're cleared. And what I'm hearing from facilities is when they interview potential staff and send their clearance up to Albany, they wait for months. In fact, the last one I went to said she sent clearance on 2 staff over 2 months ago
Mm-hmm.
and has not heard back from the state. So there's also that additional link.
There
Uh,
is a length.
Yep. In the past, what happened to her is by the time they got clearance, they had another job.
Right. And that is what happens, unfortunately. Yes.
Right. So I don't know that we can fix that on a local level, but
Mhm.
it's important for people to know that that's happening.
Right.
And what I'm
Thanks.
seeing is directors needing to take time off from their, I'm going to call it the paper side and the running of the organization to serve in the classrooms.
Correct. Yep.
So that really, it really impacts their
Right.
ability to do what they need to do.
Mm-hmm. Kathy?
Yes, thanks. Appreciate the presentation.
Sure.
This question goes along the same sort of line in that I'm wondering how much one-to-one childcare there is, where people hire what we used to call a nanny, and whether that's an entirely separate system or whether there's
Mm-hmm.
any overlap. What's your opinion about
Sure.
that as an option for parents?
Yep. So it is an entirely separate system. We can offer resources for families that are looking for a nanny. I don't have statistics, but like anecdotally, we don't see that many families looking for that because it's so expensive. Yeah. But we do have the resources to give families on, how to do a background check and that type of thing, because we want them with the right people, obviously.
Thank you.
Sure.
And then I see Vin has his hand raised again. Go
Just
ahead,
one
Vin.
more quick question or thought on the background check. The county does background checks for every person it hires. I'm just wondering out loud if somehow the county could expand that since this is such a huge community need, and if that might qualify um, to meet the requirements of the state.
I'll go out on a limb and say probably no, because it goes right through the Office of Children and Family Services. We get frustrated too because we might have a teacher that's been cleared just recently and they want to work in the after school program when they're done with their teaching day. They have to be cleared again. Like it's silly. It's a waste of resources. We've talked about it for years. It's just the way it's run. But that's why we go to advocacy days and legislators, and we do bring up the topics to try to, work it out. Yeah.
That was a good thought, though. If only
Yes.
it could
No,
be that,
great. Absolutely.
simple.
Yeah.
Are
All
there
right,
any
well,
other
thank
questions
you.
or thoughts? I know this is definitely a very pertinent topic. So, are there any other thoughts?
And any other questions, just, you can reach out to our office. Any ideas, please? We're always open to new ideas to try to get out there. So feel free.
Thank you so much. This is
Thanks for
just
that.
one more reminder to, if you haven't yet, introduce yourself in the chat and say hello. And I'm going to launch a quick poll for you. This just helps us in our planning and to make sure that the topics we choose are relevant. So we're almost at 100%. All right, and I think we are there. Thank you so much. And let me see. And we have lots and lots of thank yous in the chat too. And Kristen said it's such a tough situation that more folks should be talking about because it needs to be changed. Absolutely. All right, very good. And then we will turn it over to our next presenter, Mackenzie Shorter from the American Heart Association.
Hi, everyone. That's a hard presentation to follow. I know I am based in the Albany market and it's the same up here. I know firsthand the challenges. I have a 4 and a 7-year-old, and I was on the wait list for 2 years for daycare for my 4-year-old. So luckily my job is understanding, but it's so tough. And I couldn't vote in the thing because I'm a co-host, but I think it's definitely pertinent and it should be more talked about. And I'd love to, if you have advocacy days up in Albany, to contact me. I'd love to join in on one of those. I am going to quickly, I'm Mackenzie Shorter. Before I share my screen, I am a senior community impact director with the American Heart Association. Again, I'm based up in Albany, but I cover the entire eastern part of New York State, starting in Oneida County. So I go all the way up north and all the way down to right above Westchester. And my work focuses on community-based and clinical partnerships around the American Heart Association's priority areas of hypertension, nutrition security, tobacco and vaping, reducing risk for women, and community response, which houses our CPR and AED work. And today I'm going to talk about hypertension and a statewide program that we launch every February. And I'm going to share. Hopefully the technology gods are on our side. Can you see my screen?
Yes, we can see it. Thank you.
Awesome. How do I get rid of this so I can see mine? Okay. All right. So we call it the Check It Challenge, and we launched it in New York State. This is our 5th year. So I'm just going to talk a little bit about background on blood pressure or hypertension and why it's important. So first off, a little background on what is blood pressure. So, I don't want 1 second. I just want to get this. Okay. So blood pressure readings have 2 measurements. Systolic is the top number, and that indicates how much blood pressure the blood exerts against artery walls while the heart beats. And the diastolic blood pressure is the bottom number that gauges the pressure between beats. High blood pressure or hypertension is defined as a systolic reading of 130 or higher, or a diastolic reading of 80 or higher, according to the American College of Cardiology and American Heart Association guidelines from 2017. The higher a person's blood pressure is, the more forcefully blood is pumping through their heart, organs, and arteries. And typically, more attention is given to that top number, the systolic blood pressure, as a major risk factor for cardiovascular disease for people over 50. In most people, systolic blood pressure rises steadily with age due to increasing stiffness of large arteries, long-term buildup of plaque, and an increased incidence of cardiac and vascular disease. However, either an elevated systolic or an elevated diastolic blood pressure reading may be used to make a diagnosis of high blood pressure. And according to recent studies, the risk of death from ischemic heart disease and stroke doubles with every 20 millimeters of mercury systolic or 10 millimeters of mercury diastolic increase among people from ages 40 to 89. So here is we call it the rainbow chart, the American Heart Association and American Cardiology Association hypertension guidelines that were updated in 2017. And be on the lookout because new hypertension guidelines will be released by the end of this year. And I also want to note that a diagnosis of high blood pressure must be confirmed with a medical professional. So if you have a home blood pressure monitor and your blood pressure reading is, in the stage 1 or stage 2, that's telling you need to go to a medical professional and have them evaluate you. Also should evaluate any unusually low blood pressure readings as well. So we do have 5 blood pressure ranges as are recognized by the American Heart Association. And we work to get everybody into that normal category or sustain that normal, which is less than 120 over 80. Oftentimes, you'll see doctors, they're treating to 130 over 80 or less. So you will hear that number as well. Move on to the next slide. So the alarming reality of high blood pressure is that almost half of US adults suffer from hypertension and many don't know they have it. That's due to a lot of factors, lack of access to primary care. A lot of people in the US aren't seeing or going and getting their regular physicals. So I encourage everybody, if they have not had a physical recently within the last year, to call your doctor, maybe this week, and schedule a physical. The New York State average of high blood pressure, so that's people who have been told by a doctor that they have high blood pressure, is about 31.3%. Ulster County is right around that rate at 31.8%. And we do see in certain census tracts within Ulster County, take the city of Kingston, for example, that those rates do increase. So there is a census tract within the city of Kingston that's at 39.6%. Black and Hispanic people are twice as likely to develop hypertension, and that disparity can be related to social determinants of health, as well as genetics and other health and environmental issues. And the greater risk for hypertension results in more heart attacks, heart disease, and strokes. And a diagnosis of hypertension is a leading risk factor for cardiovascular disease. So it's a goal of the American Heart Association to help more adults control their blood pressure. And if we don't do that, we will risk the reversal of progress that we had made in fighting heart disease and stroke prior to COVID. So the Heart Association is committed to eliminating uncontrolled blood pressure. We do that in a number of ways. We work with our local healthcare organizations, our clinical partners, on things like self-measured blood pressure programming or updating their hypertension treatment protocols. We are also working out in the community. For example, we partner with the local YMCA in Ulster County on, resources around blood pressure self-management programs, and we try to get education out in any areas that we can around hypertension. So high blood pressure is preventable and treatable. So there's a number of different ways. We have what the American Heart Association calls the Life's Essential 8. So a lot of that is around healthy diet, maintaining a healthy weight, achieving sufficient physical activity, not smoking, limiting alcohol consumption, and a lot of people don't think about it, but getting enough sleep. We ask that everybody, goes in for their routine doctor visits and has their blood pressure monitored. And if you are prescribed medication, to take that medication as directed, because that's another issue that we run into, is a lot of people with diagnosed hypertension and that do have medication aren't taking their medication properly or regularly. So let's get into what is the Check It Challenge and how to implement the Check It Challenge within your organization, or if you're not tied to an organization and if you're an individual, kind of how can you participate? So the Check It Challenge is modeled after Check Change Control. The American Heart Association debuted Check Change Control a number of years ago, and it's an evidence-based high blood pressure management program, and it empowers patients or participants to take charge of their cardiovascular health by self-monitoring their blood pressure. And the aim is to eliminate the condition as a health disparity among Americans. And the program provides participants knowledge to improve their blood pressure numbers, including core areas such as managing and tracking medication, moving more, healthy eating, and taking care of mental health and well-being. Every year we launch the Check It Challenge in February, and it runs February through May. So we kick it off in February to coincide with American Heart Month, and it runs in May and ends on American Stroke Month and High Blood Pressure Education Month. The challenge also coincides with World Hypertension Day on May 17th. Our overall goal, it's a lofty goal, but is to lower the systolic blood pressure by an average of 10 millimeters per mercury among all Check It Challenge participants with high blood pressure. So it couples infographics and educational materials with health lessons. And I'll talk a little bit more about those health lessons. And we encourage all of the participants to at least check their blood pressure twice a month, although we encourage everybody to do it daily if possible. These are just some quotes over the years that we've collected from people participating in the Check It Challenge. I'll have Ninette share out this presentation afterwards, so I'm not going to read everything on this slide, but last year, for example, we had 75 organizations participate statewide, and that impact was over 400,000 individuals and employees. So who can participate? So we have seen a number of different types of organizations participate over the years. We've had sororities or fraternities. We've had faith-based organizations and housing groups. We've had all different types of employers, from banks to insurance companies participate. Workplace wellness teams is where those usually fall under when we work with employers. And we do work a little bit with federally qualified health centers or health systems where they share out the access to the webinars with their patients and the infographics. And this is our website to register. And again, I'll share out information if you're interested in registering and participating after the call, but it is www.heart.org/checkitny. So during the 4 months, February from May, we have our monthly themes. So again, kicks off in February with American Heart Month, and that theme is control your blood pressure. So all of the materials will be about hypertension, including the webinar that we have during the month of February. It's all going to be about hypertension and controlling blood pressure. March coincides with National Nutrition Month, so the health topic for March is eating smart and reducing sodium. April, when it starts to get a little bit warmer up here, hopefully, and people are starting to get out and start, maybe walking a little bit more. April is also National Minority Health Month and the American Heart Association's National Walking Day. And our health topic for April is Move More, and the focus is around physical activity. And we end in May, at the end of May, and that coincides with American Stroke and National High Blood Pressure Education Month. And the topic about in May is mental health and well-being. And we also wrap up the Check It Challenge. So the Check It Challenge is all about awareness and trying to give people easy tools to do lifestyle modifications, knowing that heart disease is the #1 cause of death and the second leading cause of premature death. Just making simple key lifestyle opportunity. There are simple key lifestyle opportunities that you can do to lower your blood pressure. You can work to reduce your weight, get out and move more, adopt a DASH eating plan or the Mediterranean diet, moderate your alcohol consumption, work to lower your sodium intake. And you can see these all have a little bit of an impact on blood pressure. So if you can even combine some of these activities, you'll have an even greater, you'll notice an even greater change with your blood pressure. So when we work with organizations, we ask that you identify what we call a Check It champion within your organization. And that will be the person that myself and I have a counterpart, Brittany, who is from Central New York, that run the Check It Challenge. That'll be the point of contact for us to disseminate the educational materials and access to the webinars. So large organizations sometimes might choose to have multiple champions. So this is the time before the kickoff in February where, this is the time to start planning on how you're going to do the Check It Challenge within your organization. We have people really get into it and do like a lot of activities, or we have other organizations that join and all they can do because of staffing, or they're incredibly busy, but at least they're receiving the information from us and they are disseminating that out to their employees. So you can make the Check It Challenge custom to how you want to run it within your organization. And some of the questions to ask yourself if you want to be a Check It champion for your organization, take a look at what current health benefits that your employer currently offers, or any of those related to the prevention of hypertension. How are you going to track participation within your organization? Again, what resources does your organization already have? Does your organization already have events and activities that are health related on the calendar that you can tie it to? And how will your leadership support the Check It Challenge? We find the most successful organizations do have buy-in from their leadership, and their leadership is actively participating and visibly participating. So we encourage anybody that wants to participate. Again, they need to register on heart.org/CheckItNewYork. Review the monthly content that we'll be sending to the Check It champions, customize it, share it with your organization and your employees. And then also invite the participants to the 4 what we call community conversations. So those are our online webinars. And then we do have another resource available called the 28-day journeys. So you can have your employees sign up for one of those. And they're little prompts that you'll get with daily emails around different topics. So Check It champion roles and responsibilities. So some do's and don'ts. So feel free to provide monitoring and feedback to participants, such as reminding participants to take their own blood pressure readings, either daily, once a week, or minimum twice a month for the duration of the Check It Challenge. Identify and note to the participants which category their blood pressure might fall into. Identify and note to the participant whether their participant's blood pressure readings have increased, decreased, or remained stable. And if you can, follow local CDC and state guidelines. But what we don't want Check It champions are making any medical diagnoses or prescribing treatment, unless you happen to be a doctor running the Check It Challenge within your organization and that participant is under your medical care. And do not disclose any personal information. And if a participant's data is accidentally disclosed to a third party, champions must notify the participant as soon as possible. So we do just put that in here on this slide, but most Check It champions, they're not collecting any health data from any of their employees, but we just want to, if it happens to where maybe you have people put their blood pressure readings into something online for an incentive through insurance, we just wanted to have that disclosure on here. So engagement ideas. So these are just some ideas that we've collected over the years from other companies and how they've run it. So we encourage, if you have an in-person space, everybody still goes into the office, set up a blood pressure station. So get a little blood pressure cuff. You can buy those easily off of Amazon or Walmart. And if you have a private area that's accessible for staff, set up a little blood pressure monitoring station. I'll have pictures of some examples on the next slide. Provide educational guidance on proper blood pressure techniques. So that is one of the infographics that you'll receive is, you know, a nice infographic on how to correctly take your blood pressure. You can host a kickoff event. If you have a relationship with a local healthcare provider, maybe see if they'll come in and do blood pressure readings as a baseline, or maybe they'll be willing to come in and do regular screenings. We do have the monthly lessons and activities, so some other ideas around Heart Month. Does your organization have a health risk assessment and encourage completion of that health risk assessment during Heart Month? Maybe do some cooking demos or a heart healthy potluck or recipe swaps during the month of March, or healthy eating challenge. During Move More in April, is there maybe an employee does Zumba on the side or is a yoga instructor on the side? Would they be willing to do a demo? National Walking Days in April. Can you get all your employees together to go out and take a walk around your building or the block, or join the local Heart Walk that we have, the Hudson Valley Heart Walk in Poughkeepsie in April? And then May is again mental health and well-being. So can you do a mental health first aid training, or if somebody can come in and do a mindfulness training or a meditation demo? So those are some ideas. Here are some pictures of example blood pressure stations that different organizations have set up within, you know, their building. So it could be very simple, just in these blood pressure devices they're using run around $55, and they've printed out the educational materials they provide and had some bleach wipes next to it, just, you know, to wipe down the device. Incentive ideas, check with your insurance carrier what they might already have. Maybe a Fitbit or a blood pressure device or a gym membership. So these are all incentive ideas that companies have given out for employees that, you know, commit and take their blood pressure during the Check It Challenge. And I know I'm running towards the end of time, so I'm going a little bit quickly. We do have that one-on-one technical support from the Heart Association where we're giving out that monthly content and support. So we have an implementation guide that you'll receive. You'll receive the monthly content emails, and within those emails, there'll be sample social media posts, infographics, email templates for your employees. And we also have our 4 scheduled community conversation webinars that are also recorded, and the 28-day journey to better health. Here's a snapshot of some of the monthly content you'll receive. So here's a picture of that infographic around the technique for getting a proper blood pressure measurement, blood pressure logs. And we do have our 4 online webinars. So they're lunchtime webinars hosted via Zoom events. So these are the dates. They're all towards the end of the each month. They will be recorded in case that time doesn't work. And the topic of each of the webinars corresponds to the month theme. And we feature health and wellness experts from across New York State as panelists within each webinar, and each webinar has a Q&A at the end. We have another resource, which is our 28-day journey to better health. So there's one around physical activity and one around nutrition and one around hypertension. And these are where your employees can just sign up and they'll get a little nudge each day to make a small change, because we know it takes a while to build a habit. So these are just little monthly or daily nudges that you'll get automatically emailed, and you can always pause them if you want the emails to stop pretty easily. So that's another resource we offer through the Check It Challenge. And then the local contact for Ulster County would be myself, and then we do have our checkitny@heart.org email box as well. I'm going to stop sharing because I know I'm right at 250, and to see if anybody has any questions for me.
I just wanted to say that some of our members may remember getting these emails last year and the year before, because I did share out the content with the group. So if you're new to the group, it might not ring a bell, but if you've been here for a while, you can see that they're really fabulous messages and easy to share. It's a canned program. Everything is really done for you. So it's not very time consuming. And at the health department, we're really hoping to engage all of your coworkers so that they can also benefit from this content, and have, each of you be the champions within your agency registered through the Heart Association this year, so they can get their numbers up for number of agencies who participate. So please know that it's easy to do, and I hope you will sign up. Thank you.
I'm going to put the website in the chat along with my email in case anybody wants to talk offline. I'm willing to talk through implementation. And again, if you can't sign up to be a Check It champion, we encourage at least participation in the webinars. We've gotten wonderful feedback over the years on the webinars, and people seem to really like them. A lot of great health information shared.
Thank you so much. That was so informative and really wonderful. Like you said, I feel like lack of sleep and stress are two things that are often overlooked and how that could contribute to hypertension. I just found out that the app Headspace is available for free to teachers. So if you know any teachers in your life, encourage them to sign up because it's a really great meditation and sleeping app. So I just thought I'd just throw that out there. I'm going to launch the next poll. Oh, I think there's a question in the chat from Marge. She asks, do you do outreach to community groups such as senior meetings?
We do occasionally. We have 2 staff down that serve the Hudson Valley area, and then myself. So it just depends on timing and what you're looking. And we are looking to rehire, some of you might know our past Heartcore member, Natasha. She was our go-to for a lot of these presentations. So I'm looking to rehire that position to help, because we do get, especially during Heart Month, a lot of requests, and I have over 20, I think I'm like 25 counties under me. So yeah, it depends on the timing, if we can do that. And that's also why we have these webinars, especially the one in February, because we encourage that kind of offsets. Sometimes if we can't make it and do a presentation, we at least have that resource to share out.
Very good. Thank you so much. And I'm just going to quickly launch this poll. And once we have 100% of people answering, I will end that and then share my screen. Almost there. Couple more people. All right. Very good. Okay, I'm going to go ahead and share my screen again. There we go. Zoom poll, we've done that. So next up, we have our movement break, which I realize now I have to stop sharing so that I could share with the sound. For this, I will suggest maybe you turn your camera off. It's going to be a fun one. I really encourage you to stand up because this is part of our healthy meeting guidelines. We know that sitting is not very good for us. So I encourage you to stand up to do this. It's like a little brain break. It'll be fun, I think. And it's just 1 minute, but unless you're feeling brave, feel free to turn your your, oops, and I did it again. Let me do a new share, advanced. Advanced sharing options. No, that's not how we do it. Computer audio. Okay, here we go. Can everybody see this? I'm going to play it. Hopefully you can hear it.
Hi, everyone. Our
I
brain
don't
break
think you're screen sharing it at.
your
Oh,
nose.
no. Okay. Thank you. So that's shared. Okay, let's see again. Okay, can we see?
Yes.
Yes,
And
good.
can we
Hi, everyone. Our
hear?
brain break for today is
Hear and see.
Okay. Very good. Okay.
nose switcheroo. This type of brain break activates our midbrain, and the type is to help us focus. So to get started, you're going to cross your wrists in front of your face and extend your pointer fingers up towards the ceiling. Going to take one pointer finger, place it on your nose, and take your other pointer finger and place it on your ear. Very good. Now we're going to get ready to do the switcheroo. So the pointer finger that's on your nose is going to go to your other ear, and the pointer finger on your ear is going to come to your nose. Very good. All right, let's try it again. So ear to nose, nose to ear. And again, ear to nose, nose to ear. See if you can pick up the pace a little bit as you get comfortable. There you go. Nice job. This is a great one to practice. All right, let's do it one more time. Thanks, everyone. Great job doing our brain break ear, nose switcheroo.
Well, I hope you all have.
Did you know that Amazon has a $15
Oops.
million fund that they have to pay out every month? And here's how you.
Stop my. Okay, I hope everybody had fun with that. We did something similar in a meeting I had yesterday, and I thought it was such a great little brain teaser, and a good way to make your coworkers think you're a little bit crazy, maybe. So with that, I will move into our networking session. So share. Melinda always did this seamlessly with her sharing and resharing and unsharing, and it's like I haven't quite figured that out. So we did our movement break. Oh yes, I'm glad I shared this because this is a great opportunity for me to remind you that we have our Healthy Ulster Google group. So when you attend these meetings, this gives you access to a Google group that we have that is used to share and receive the latest research briefs, program updates, professional development opportunities. So if you are new to this meeting, you will be receiving an invitation. You probably are already on here, so you can email this group, healthyulstercouncil@googlegroups.com, with any of your program sharing or updates once you're a member. Oh, collective action. So this I wanted to briefly touch upon. Of course, our planning for the year doesn't always align with the calendar year, but for going forward, I'm trying to do a little bit of research on how we can incorporate more health equity as part of our collective action for this group. So this is, looking at like how we can make sure that we're increasing the knowledge about different creating a broader understanding about creating creating more knowledge around structural and systemic factors that can impact health outcomes. So I'm doing some research on how to get us some different trainings and resources, because this is something that really cuts through all of our work. So if anybody has any thoughts before we move into our networking session, I thought I would just share that with the group because we are a group together and I want to make this, a collective decision too.
I just love that idea because it really aligns with like 20 people, Healthy People 2030, and they have some great infographics on that, and it will affect all of us in our different roles, serving different populations. So it feels like a good topic. So I look forward to that. Thank you.
Absolutely. Yeah, of course. They Healthy People 2030, that's been prioritized in their action plan. So it's nice to utilize the resources that they have identified too. So we can use them together. And with that, I will move into our networking session. So for this, just keep it short and sweet. Briefly share your organization's upcoming programs or events. I will call upon you, and that you can just start by stating your name and organization. And then you want to focus really on a specific event or activity or program that's happening rather than like an overview of what your organization does. So Joan, I see you have your hand raised.
But Joan Carl from the Hudson Valley chapter of the Alzheimer's Association. Mackenzie, I just have to tell you that everything you spoke about, we talk about in our Healthy Living for Your Brain and Body. So all those strategies and techniques to lower blood pressure also help with cognitive health too, because a healthy heart is connected to a healthy brain. So that was amazing. That was so good. Wanted to tell you about an upcoming event that I know you're all excited about. It's the ice jump called Sub-Zero Heroes at Berrien Park. It's going to be on Saturday, February 8th. So heroes jump in to the lake, and our sidekicks actually raise the funds for the hero and stand on the shore with dry towels or blankets. Also in the chat, I posted my contact information. We are hiring a program manager for our community engagement team, which I'm on, and that position will report into me. And that role will cover Dutchess, Ulster, and Orange counties. So please take a look at that posting and take a look at our website too. And I wish everybody health. Take care.
Thank you so much, Joan. I will move across my list. Marge, do you have anything to share? Oh, you're on mute. I'm not sure if you're trying to get off mute or if you're talking.
Hi,
Oh,
can you hear me?
sure.
Okay,
Oh,
so
no, I
I'm
can
back.
call on Marge. Unless you have to hop off, Shahara, I'll call on you next. Is that
Either way
okay?
is fine, whatever works.
Okay.
Okay, Marge, go ahead.
Okay, I'm a registered nurse. I've been involved with Hard Care Forever. I still do community education and programming. And I also am linked to the children's daycare services in Ulster County, Sullivan County, Columbia County, and Orange County. So I'm available mostly for educational pieces. And pretty much I share to senior sessions, and I do it as a volunteer.
Very good. Thank you so much. Shahara?
Hi, good afternoon. I'm Shahara Dassi. I'm the executive assistant and NOEP supervisor at People's Place here in Kingston. And I just want to say both presentations were excellent. We've done some work with Mackenzie. Hi, Mackenzie. And also, of course, with family and all the things they do. So real quick, I just want to say that we still have our regular office open hours Monday through Friday from 10 till 1 and Wednesday evenings 5 to 7. One thing I wanted to mention is we do a specialty dinner every month, and we alternate between Latin food and soul food. This month's January will be Latin food, and that's open for anyone in our community cafe, and it will be held on the Lunar New Year. So that's Wednesday, January 29th from 5 to 6:30 in our community cafe. And that's the same night that we're open late for the food pantry and the thrift store. If you have any questions, give me a call. Thank you.
Very
Thanks,
good.
Nanette.
Thank you. All right, Danielle?
Good afternoon, everyone. There's actually 4 of us on here from the Rural Health Network at Ellenville Regional Hospital. We have Samantha, our director, James Centeno, the coalition coordinator, as well as Courtney, our nutritionist. So if you don't, I'll speak for everybody and then they can pipe in so we don't have to go down through everybody. So we have a substance use side of the house. We have a wellness side of the house. We offer free fitness classes throughout the community, anywhere between 12 and 15 locations. We have a pharmacy program where we offer free fruits and vegetables throughout our community. We have our Sharps collection on the last Friday of the month. So our next one is on January 31st from noon to 4 p.m. But if those hours don't work, folks can come in and drop off their full Sharps collection and receive an empty one. James and I also have a outreach in our local pharmacies. Right now, it's Matthews Pharmacy here in Ellenville and Catskill Pharmacy out in Kerhonkson. We have locked bags for keeping our medication safer, as well as handing out doTERRA bags, or environmentally friendly way of disposing medication. We do mail both items out to folks in the community.
Sorry.
So, yeah, we have community health workers here. If anybody's looking to find a new provider, switch provider, help with insurance, any social determinant of health, folks can either refer community health workers to us or have community health workers just reach out to us directly. So, we also have a buprenorphine induction program in our emergency room. So if someone would like to stop using opiates, they can come into our emergency room, be evaluated for Suboxone, and be connected to a Suboxone provider, whether it's a treatment facility or a primary care physician that prescribes Suboxone. So that's another program. If James or Samantha or Courtney would like to add anything, I think I might have hit a little bit of everything there. So
yeah, nice job, Danielle. Just wanted to wrap up by saying all of the services that Danielle is talking about are now available on our Unite Us platform. So we are active on there and accepting referrals through that social care network platform if anybody would like to refer someone to us.
you can also find us at www.sudhelpulsters.org. There's Narcan trainings there. We can mail out Narcan. You'll find us and other agencies that have harm reduction supplies that can be mailed out. If someone's looking for inpatient, detox, outpatient services, mental health services. So give that a look. Our Ulster Partners for Prevention Coalition. It's a county-wide coalition to help folks make healthier decisions, safer storage of medication, and disposal of unused medication. So you can find all that on that website as well.
Great, thank you so much.
Thanks, Annette.
Yeah, of course. And let's see, I will go to Robin.
Hi, everybody. I'm Robin Scarkilly. I am the Public and Community Affairs for New Vans Health, Northern Dutchess Hospital, more specifically, and also our primary care locations within New Vans Health. This is my first meeting, so I love what I'm seeing. You guys are all such a great group of folks. Great presentation so far. But yeah, so I mean, we don't really have any upcoming events, but a big part of my role is organizing those events. And, you know, during the warmer months, you know, I organize some community lectures where our physicians or healthcare professionals, you know, get in front of our community and host a series of lectures on various health topics. And if any of you would like to work together and collaborate on something, I'd be more than happy to do that. Another thing that I do, I work on editorial pieces. So I work very closely with the healthcare professionals in the hospital and the New Advanced Health medical practices on popular or timely topics. So if you guys are also looking for anything to include in your community newsletters or anything, I'm more than happy to work on those pieces as well. And yeah, just a few months ago, we opened up a new primary care practice on Ulster Avenue in Kingston. It's a family medicine practice, so we can see people of all ages. And, regardless of, background, income, insurance, we see everybody. And you can make your primary care appointment and get seen by one of our physicians fairly soon. So, yeah.
Very good. Thank you so much. And welcome. Let's see. Christine, do you have any updates?
I don't know if you can hear me.
Yes.
Okay. Yes, we're still doing the mall walk every Tuesday at 10 o'clock sharp up in the old Hudson Valley Mall. And we have a lot of exercise classes at our senior hub in the room next door to our office by the VA services, as well as a game day. We have chess games on Monday. It's all in our newsletter on the county website. And many lunch and learns at several locations throughout the county. We have a craft corner every third Friday in the hub. And right now we're scheduling a Valentine's Day bingo. So we do a lot of fun things as well that we'll be having in the hub, but it's all in our newsletter every month. It's called The Buzz. We distribute them all over the place, different diners and some of the doctor's offices and lots of different places where you can pick them up. So Repco, we hand them out to Community Action and places like that where they make sure they get them out to senior housing. So you can just go on the website as well and go to the Office for the Aging and you'll see all our upcoming events. But we have lots of good fitness classes and things like that.
That's fantastic. Thank you.
You're welcome.
And let's see, who haven't I called on? Yolanda?
Hello, good afternoon. How are you? Yolanda Brewster from the Ulster County Department of Health, Immunizations. Our new VFC, VFA immunization clinic schedule for 2025 is available out on the website. Our next clinic is going to be held on February 5th. We hold clinics the first and the third Wednesday of every month by appointment for uninsured or underinsured residents of the county.
Very good. Thank you so much.
Thank you.
How about Maud? I'll give you a second to unmute, Maud, if you're there. If not, I will move on. All right, let's see. Did I call on Cynthia yet?
Hi, I work with Yolanda at the Ulster County Department of Health in the immunization program. So same thing, great presentations. Thank you for having me.
Of course. Thank you. Let's see. How about Anna? Do you have any updates? Programs you want to shout out?
Currently, but I'm sure in the future I will. But
very good. And then Carrie, do you have anything else? I know you just presented, but
No, I don't think anything else. Thank you.
okay. Yeah, of course. And let me go through the list and make sure. I will ask, Kushbu. Hello. Do you have any programs coming up? Not to put you on the spot right away, but
Absolutely. No, sorry, I had few network issues because of which I had dropped out of the call. I do have few updates, few latest reports on tobacco which were released recently, which I'm going to share it with the group through email. These are mainly our Surgeon General's report related to e-cigarettes as well as the trends of electronic e-cigarette consumption among youth. So please be on a lookout for those. Apart from that, similar to what Carrie had mentioned about the meeting up with the legislators, that is something which we do as well. So we will start making our meetings with the legislator, so educating them about our program, meet them in Albany to bring awareness about the program, which we have been doing in their region. So that's pretty much it from my end.
very good. Thank you so much. And then Katrina, did I call on you yet? I don't think so.
No, not yet. Hi, everybody. I haven't been to this meeting in such a long time, but it's my New Year's resolution to come back regularly. So hi, if you don't know me, I'm Katrina Williams. I'm the Deputy Commissioner at the Ulster County Department of Mental Health. We offer a variety of services to our residents. I will put our brochure in the chat so you can take a look and familiarize yourself if you're not already familiar. And I will just quickly say that we've been most busy recently gearing up for the opening of the Crisis Support Center, which will be at our location, 368 Broadway in Kingston, also known as the Ulster County Center for Wellbeing, which will be a hub where not only we live and the Crisis Support Center lives, but we'll also have an array of behavioral health services under one roof. We're already joined by Access Supports for Living, who has a walk-in mental health and substance use clinic, and Samadhi, who provides outpatient substance use disorder treatment currently. So lots going on over here. Happy to connect with anyone who's interested in learning more. And yeah, put the brochure in the chat. Thanks all.
Thank you so much. And then Maud, I see you had left and then you came back. I'm not sure if you are having technical difficulties, but feel free to unmute yourself and share any updates if you have them. If not, no pressure. All right. Well, how about Stacy, do you want to? Oh yeah. Do you want to give updates, but also a little plug for Healthy Ulster Radio?
Absolutely, that's great. So one benefit of membership in Healthy Ulster Council is that we can provide you access to free airtime on the Healthy Ulster Radio. My boss, Vin Martello, is the host, and he's very great at keeping it conversational and quick and easy. It's pre-recorded in advance, so you're not on the spot. If you say something you don't like, it gets edited out immediately. So you'll be able to reach over 3,500 people in the Hudson Valley being on the radio show. We have the schedule going for 2025 now, and there's spots to sign up. So please feel free to contact me, and I would like to get you reserved so you can talk about your issues at your agency that you want the public to know about. Additionally, I help with our social media content. So if you have a great event or something, important to talk about, I want to help amplify your message through our social media channels as well. So reach out to me for that too. Thanks.
And I will say I have been on Healthy Ulster Radio and I was terrified at first, but once you're on, it really is so easy. You can keep your camera off, and just knowing that it's not live is very helpful. All right, I think that sums it up. Oh, hello.
Yeah, it's Maud. Sorry, I was trying to call earlier and talk, and then I don't know what's happening with my computer, but I'm more than happy to say hello and share a few updates for my organization as well.
Absolutely. Thank you so much.
Of course, no worries. Hello, everyone. So my name is Maud Alobawini, and I'm the supervisor for the CUP program for MISN, which is the Maternal Infant Services Network. We offer a lot of youth programs that is under the CAP grant. I'm not sure if anyone is familiar with that, but I'm more than happy to share some few details. A few of those programs include the TOP program, Making Proud Choices, and those programs really are geared towards having youth out there be healthy, make, smart decisions about, sex as well as their education, making sure they are staying in school and not dropping out due to teenage pregnancy. Some of our programs have a community service learning component as well, which is pretty neat, especially for kids who want to, apply for college and things like that. And so we are starting our own internal top program at MISN in our Newburgh and Kinston office. And so anyone that has youth or access to youth who would love to have them join our programs, please feel free to reach out. I would drop my email in the chat as well for anyone who would like to reach out as well. And again, nice to meet you all.
Thank you so much. And what was your last name?
Oh, it's a mouthful, but it's Aloba Uni.
Aloba Uni?
Yes, Uni. So it's ALOBAWONE.
Very good. Very nice to meet you. Thank you for sharing.
Of course.
All right, everybody. I think that wraps it up. Or did I get everybody actually? Because going through the list and people jump around once they come on and off camera. So don't be shy if I accidentally skipped over you. All right. Well, thank you so much for joining us. I'm really looking forward to the rest of the year with you and expect some updates from us soon. Thank you all so much. Have a fabulous rest of your day.